She's sitting in a hospital bed, sunglasses on, indoors. A nurse reaches over to take them off her face, and then she throws up. Right there on the floor, not because she's sick to her stomach, because the light did that to her. Just the light. 5 days earlier, this 24-year-old woman, we'll call her Casey, was fine, totally normal. Now she can't look at the lamp without vomiting. Her neck is locked stiff, and when doctors ask her simple questions, she starts saying words that don't make any sense. Whatever this was, it had already reached her brain. Five days before that ER visit, Casey is just getting dressed, putting on a shirt, normal Tuesday stuff, and her right thumb explodes in pain. Not a little twinge, a sharp electric jolt that runs straight from her thumb up to her elbow. She figured she just moved wrong. You know how that goes. You tweak something, you shake your hand out, and then you move on. Except it did not go away. Then her left knee starts throbbing, then a sore throat shows up out of nowhere. Then, and this is the part that should have scared anyone a lot sooner, she can't stand to look at light. Back in the ER, things get stranger. Casey's fever is climbing, her heart's racing, blood work shows a spike in white blood cells, her body's throwing everything it has. Doctors start asking her questions, basic stuff: where are you, what day it is. She keeps repeating 3 words: boyfriend, lap, cheeks. Some of the older staff just wrote it off, chalked it up to confusion, and moved on. One resident didn't. Doctors need to see what's swimming around her nervous system, so they do a lumbar puncture, a needle into her lower back, pulling out cerebrospinal fluid, a cushioning liquid that's supposed to be crystal clear. Hers came out yellow, hazy, cloudy. Something in there is alive, making waste. This is bacterial meningoencephalitis. Her brain and the protective tissue around it are both under attack, except there's a brutal problem. No bacteria grew in the culture, no viral DNA showed up. Days of testing, nothing. And Casey doesn't have days. A few weeks earlier, a 60-year-old woman, we'll call her GW, is baking cookies for her grandkids. Totally ordinary afternoon, and her hands feel like they're on fire. The pain starts in both thumbs, then shoots up to her elbows, then jumps to both ankles. Her doctor calls it arthritis, gives her steroids, they don't touch it. The same resident who could eventually treat Casey works through GW's case first. Every common cause comes back negative. One test is left on the list, and it's the one nobody wants to ask a 66-year-old grandmother about. Gonorrhea. GW's case broke the rules. The bacteria had escaped, spread through her bloodstream, straight into her joints. The resident confirms it, treats her, watches her recover, then files the case away. In this memory, weeks later, Casey walks in, sudden joint pain, then confusion, then a brain infection. Nobody can identify. He remembers GW, so he asks the lab to test Casey's spinal fluid again. But this time, specifically for gonorrhea, it is positive. Bacteria is in her spinal fluid, in her meninges, in her joints. It had gone everywhere. It was never supposed to go. Then, in one clear moment, Casey's finally explains what boyfriend and clap meant. A month earlier, her boyfriend had picked up an infection outside their relationship and told her about it. She got treated with antibiotics. As a precaution, weeks later, before anything else changed, they were intimate again. By then, he picked up something new, something the earlier antibiotic never touched. It explains how she got infected. It doesn't explain why the bacteria spread through her entire body instead of staying where it usually does. That answer wasn't in Casey's hospital room, it was sitting in public health database. 2 years before ever Casey got sick, health officials in southwest Michigan had already noticed something strange. More than a dozen patients had shown up with gonorrhea that had spread through their bodies, not just a local infection, full disseminated disease. Just like GW, just like Casey, none of those patients knew each other. But when scientists sequenced the bacteria's genome, the strains were nearly identical. One tiny mutation kept appearing in every disseminated case. It didn't make the bacteria resistant to antibiotics, it made it mobile, capable of breaking loose from where it landed and traveling through the bloodstream, into joints, into fluid, into the brain. And 2 years later, the exact strain was still circulating, and it found Casey. Back in Casey's hospital room, none of that uncertainty mattered yet. What mattered was that one of the 4 medicines she'd been started on before anyone ever knew what was attacking her happened to work against gonorrhea. Ceftriaxone. The doctors dropped everything else and stayed the course. Over the following days, her fever broke, the confusion lifted, the words started making sense again. She recovered fully. She walked out of the hospital because one resident remembered a case from a few weeks earlier and refused to stop. But we don't know. As of now, this exit stain hasn't reappeared in Michigan since the early 2020s. Gonorrhea cases in the state have actually gone down, but the bacteria that nearly killed Casey had spent almost a century proving one thing. Over and over, it adapts. Every single time we think we've closed the door, it finds a new way through. Thank you everyone for watching, and I'll see you in the next video.